September is Self-Care Awareness Month. And if you've never had a self-care routine, now may be the perfect time to start. Here are some tips from the Cleveland Clinic to help you get started. From bubble baths to meditation to exercise, we're always hearing about self-care routines. Self-care itself is important. It helps us maintain our physical and mental health so that we can show up in the important aspects of our lives and be our best selves.
Self-care is anything that, kind of we deliberately kind of do, or maybe in some instances refrain from doing, with our own well-being in mind. Anything that promotes our own physical, emotional, psychological, or spiritual well-being doesn't really have to be any more complicated than that.
Dr. Matthew Sacco from the Cleveland Clinic says self-care should be intentional, meaning you should make sure to set aside time in your normal routine to do it. It doesn't have to be expensive. What matters is that you're feeling good and relaxed. And that includes going for a walk if you enjoy nature, journaling, or socializing with friends. One important thing to remember, self-care is not about being selfish.
So doing this kind of work thoughtfully, in a very planned way, it is absolutely a vital part of us as at an individual level being more effective in the world around us. And I will often say, especially to women, you got to be, it's the oxygen mask on the airplane analogy. They tell you that when you get on, you got to put it on yourself first before you help others.
Another important thing to remember, developing a self-care routine that works for you can take some time. Don't feel pressured to feel a certain way or to meet certain expectations at the beginning of your journey.